Well, howdy YouTube family. It's Bolt CRNA coming to you again with another day's topic. Today, we're talking about, as a CRNA, do you get orientation to your new job? What's orientation like as a new grad CRNA? And what's orientation like if you've been working somewhere else before and you're a little experienced and you've gone to a new hospital? Like, do you have this long orientation process, or they just throw you in feet first? Let's get into it. So this comes up occasionally when people are on Instagram or following me and watching me, which, by the way, go follow me on Instagram, Bolt CRNA. I post daily videos over there. So people will see me working and doing things, especially recently when I started per diem at another hospital, and a lot of people were curious. They were like, oh man, it seems like you were just working there all of a sudden. Did you not have to do orientation? What was the process like? So here's the reality, yes and no. There is orientation, it's usually called proctorship as a provider. It's usually called proctorship. They changed the wordings around. Everything has to be fancier sounding when you become a provider versus when you are a staff nurse. So it's called proctorship usually, but it's essentially orientation. And proctorship is really just so the group can assess your skills a little bit and make sure that you're providing anesthesia in a safe manner. They don't know you. There's a certain base level of competency expected of anyone who's a licensed anesthesia provider, because you of course went through all of the advanced level, graduate, master's, or doctoral level education. If you're a physician, you should have gone and passed through residency already, and that should be like a basic barrier for quality control for them. And then of course all of you should have passed boards, and if you pass boards, you should have known a decent amount of academic knowledge related to anesthesia. So yeah, there's a certain amount of quality control that's just an assumed amount when you get a job as a CRNA. Even as a new graduate, you're kind of expected, like, you should know how to do this for the most part. It's not like when you were a new grad nurse and you come into the unit and everybody knows, like, okay, you're an idiot, you know nothing, you don't know how to be a nurse, and we have to train you on how to be a nurse for the next year, and then you might be capable. As a CRNA, it's expected, or a physician anesthesiologist, it's expected when you're finished with training and past boards, they expect you should be able to practice pretty quickly here. So really, proctorship this is the door code to the supply room. This is where we keep the airway supply cart. This is the number to call the anesthesia techs for. This surgeon is very particular on these types of spine cases. We always run TIVAs here with this types of mixes usually. PACU is this way, like that kind of stuff. It's orientation in the sense of, like, this is where this A plus B equals C and go here kind of stuff is. Those are things that you need to know when you go to a new hospital. You're not going to be able to walk into a new hospital and know all of that stuff immediately. You should be able to pick it up fairly quickly though, especially the more experienced you get and the more you've worked as an anesthesia provider in different hospitals. You find that there is a certain rhythm and flow that most hospitals have, and it doesn't take you long to kind of figure out that rhythm and go with it. But as a new graduate, yes, there is a little bit more depending on the group that you're working in. If you're working in like a giant, huge academic hospital that's got 80 ORs and multiple sites of anesthesia delivered in different places and lots of very critical types of cases and things happening, and research cases and all these different types of situations, they're probably going to, and you're a brand new graduate, they're probably going to have a more extended orientation for you. I recently worked per diem for a larger academic facility that fits that bill. And for me, I got, what did I get? 3 weeks? No, 2 weeks. I think I got 2 weeks. 2 weeks of 4 to 5 days a week of orientation. And then after that, it was like, we showed you the GI suite rooms, we showed you the eye center rooms, we showed you the ambulatory surgery center rooms one day. We did one of the main ORs one day and another main OR in the other building another day, and you got like 2 days pretty much in each location. And that was it. And then from there, it was like, call us, here's our cell phone numbers. If you run across something you don't understand or you need assistance on, call us or the anesthesia techs or whatever, and we'll try and help you. And so that was pretty much it. And there definitely were times in that first month where I was still trying to figure out there's like 4 different locker rooms depending on which site you were at in the hospital. And so I would get lost just trying to get from which locker room to which side of the hospital to which parking deck I was supposed to be in. So that's very confusing. That can be tough, especially as a new graduate. One of the other people who had recently graduated, they started there at the same time I started, and it was their first job as a new grad. And they got, I think, maybe a week more of orientation than I did, but not that much more. So 3, maybe 4 weeks of orientation, and then they were on their own as a new graduate. For my first job as a new graduate, I think I got 2 days, 2, maybe 3 days of orientation. It was a smaller practice of about 8 CRNAs, and there was 1 physician who did administrative work there. And so, yeah, I mean, things needed to get done. They needed me taking cases. And so they expected I was capable and competent. And so pretty quickly, within a couple days, they were like, this is the OB department one day, here's a C-section, here's how we do our labor epidurals here's where the supplies are at, here's the emergency airway supplies and glide scope for, when you're on call at night with the OB patients, here's our OR rooms, this is our flow. And in a couple days, I was on my own. In fact, by the second week, I was taking 24-hour solo OB call in the hospital by myself, where I was the only anesthesia provider all night. So yeah, that's just the different extremes of some of the systems. Like I said, as a new graduate, you might get a little bit more orientation or proctorship essentially, but ultimately there is not a lot of orientation and proctoring as a CRNA or physician anesthesiologist. It's kind of expected, like you're going to be able to know how to do your job, and that's not a problem. I mean, pretty much your schooling and education, I mean, I've said it a million times, it's long and it's grueling. So once you get done with that, you should be prepared to go out into the field and do what you do. In fact, I feel like the last probably 1 or 2 rotations I was in as a third year, I was like itching to get out and do it. And there's times as a third year where you're running cases independently on your own. You're pretty much doing cases all by yourself, and you're having like backup people to call if you need their help, but they're pretty much giving you full autonomy and letting you kind of run the cases and do everything on your own. You form the anesthetic plan, you implement the plan, you intubate, extubate, take the patient to PACU, give report, pick up your next patient, take them, put it in a block, blah, blah, blah. You do the whole process a lot of times as a third year. And there were definitely times towards the end of third year where I was like, I could be earning money right now. Like I'm actually like just performing work for the practice. And it is nice. In retrospect, it's of course necessary as part of your training to go through that step. And just because you technically could be like performing a job and getting paid at that time, you're still in training, you're still performing, you're still getting your numbers, and you still are there, enjoying having the backup of someone else who can jump in and help you if you mess something up or you forget something or need help. So yeah, don't, you third years out there, I know you're thinking it. You're like, oh man, I wish I could be out making money right now because I'm working for free right now. But, take in this time, try and learn as much as you can from your preceptors. Once you get out, you will be expected to perform pretty quickly without much orientation, as I've said. So, just hone those skills now and just get yourself ready to roll. Now, in one area that this might be slightly different is if you're going into a position as a practice that's highly specialized. Like say you're graduating, a couple of my classmates graduated, and like one of my friends, she went straight to a major cardiac ICU, or not cardiac ICU, a major cardiac anesthesia group. And they did, open heart surgeries and major valve replacements and things like that. So you do those rotations in anesthesia school and CRNA school. So you will have had cases like that, and you will have had exposure to that. But those are very complicated cases, and there's a lot of moving parts to that, and that's not something that you want to just jump into with a couple days of orientation right out of school and just be said, go on and, go forth and prosper. So in those kind of situations, you probably will have a little bit more orientation and a little bit more proctorship just to make sure that you're totally comfortable and that, you're feeling like you're capable of handling all the different pieces that are moving in those kinds of cases. Because you're sharing, like with cardiac cases, you're sharing that patient with a perfusionist, the cardiothoracic surgeon. There's lots of things you all have to collaborate together on those cases to make sure the anesthetic and the patient is being done safely and smoothly. So yeah, those are things that you want a little bit more time on. If you're a physician anesthesiologist, a lot of times they will do an entire year of fellowship after their residency where they just focus on cardiac cases and just feel comfortable with cardiac cases. So when they get out and they go practice in cardiac cases, they feel better about it. As a CRNA, I don't believe there's a fellowship for us for that. There may be in the near future. I know there's some other fellowships. I don't know that there's a cardiac. But yeah, if you don't do a fellowship in it, it stands to reason that you might want to do a little bit of a prolonged orientation in cardiac. Where I did my cardiac training as a student, the CRNAs ran all the major cardiac cases there, heart transplants, LVADs, CABGs, everything like that. And they worked on a team with, I think, 2 or 3 cardiac anesthesiologists who would float around and like get TE images and stuff during the cases. But the cases were all started and ran and done completely by CRNAs. So there, as a new graduate, you would have to do 6 months of orientation. And they actually usually wanted you to do they usually wanted to start you on the general cases as a new grad first. And then if you prove to be pretty competent and you're still interested in cardiac after that point, then they would let you come onto the cardiac team. And then you would have to kind of be in like a probation orientation period it was like 6 months, I believe. And those CRNAs were very brilliant and they were extremely competent. And so I feel like that's a pretty adequate method of training you in that kind of specialty. So I said all that about orientation earlier, about it being rapid and quick in a couple days. That's not usually for your highly specialized areas. And that also includes kind of like pediatric, especially if you want to do advanced peds like pediatric neurosurgery and stuff. One of my friends went to a pediatric hospital right after we graduated, and she had more than like a week of orientation there because you're dealing with like 24-day-olds and you're dealing with very complicated heart conditions and things like that with little kids. So you want a little bit more time to get accustomed and to feel comfortable in that setting. Well, all right, guys, that was everything. That's what the orientation is like as a CRNA. I hope that was informative to you. If you're in CRNA school now and you're starting to get kind of worried about it and thinking, what's my orientation going to be like? Am I going to be ready? I know some of the SRNAs that I teach in clinical rotations and stuff, they'll mention that they're graduating in a year and they're nervous and they're not sure, am I going to be ready? And they have a lot of fears and stuff. Don't worry, there are orientation systems. If you feel like you're not ready yet after a few days, you can voice that you need extra help or you want more time. Never feel like you need to pretend like you're comfortable if you do not feel comfortable yet. Do the safe thing and say, hey, I still don't feel comfortable after a week. Can we take a little bit longer? And the group will accommodate. Hit me up in the comments below and let me know how long your orientation was. How long was your orientation for your ICU unit? I remember my ICU unit as an RN, it was like 3 months. I think I had 3 months that I was on orientation there. But I've heard of some people doing like entire year-long nursing residencies in the ICU, which is, sounds awesome. Not offered to me when I was back in my ICU days, but cool for you. And also make sure and hit that like button, smash that like button, pound that like button for the YouTube algorithm because it makes it so that other people see this video too and I can help out more people. Join the membership over here if you're looking to get into CRNA school or you just want behind the scenes information about me and exclusive videos that I post monthly and things like that. Go over to the membership tab and join up over there. I'd love to see you. And until next time, that's Bolt out.